Professor Shibasaki, and it's rather difficult to catch you at the midst of a very busy international meeting of ICC in 2010. And I'd like to begin with some questions. Could you tell us about your early years as well as your education?
Yes. When I was a postgraduate student, I mean the Ph.D. course after finishing medical school, first I did an anatomical study of corticospinal tracts because my professor, my boss mentor, Professor Yoshigoro Kuroiwa, had to give a special lecture in the Japanese Medical Congress on spasticity. So at that time we were interested in the anatomical background of spasticity. Actually, what we did is I analyzed fiber construction, fiber composition of corticospinal tracts in patients with unilateral internal capsular lesion, in other words, stroke patients, and amyotrophic lateral sclerosis. Both stroke patients and ALS patients show spasticity. And by analyzing fiber tracts, we found some difference. Patients with stroke, of course, all fibers are damaged, while ALS patients, only large corticospinal tract fibers are damaged. But both patients show similar spasticity. That's how I became interested in motor cortex and corticospinal tracts. And then when I did residency in University of Minnesota hospitals under Professor A.B. Baker, my teacher of EEG was Dr. Fernando Torres. He was a very good teacher, and I was very much impressed by him. So after coming back to Japan, I thought, since I did anatomical study of corticospinal tracts and motor cortex before I went to the States, so I thought I can combine physiological EEG with anatomical study of motor cortex. That's how I became interested in
it's very interesting
cortical activities.
I thought that you've done your thesis through physiological things, but that's a morphological.
I was totally anatomist.
Oh, that's very
pathologist.
But after you get you went to US, you faced physiology.
Yes, mainly because anatomical study could not be applied to clinical situations, where motor physiology can be done clinically or non-invasively.
So that's more patient-oriented.
That's correct. Yes.
I see. And a little bit similar question: why and how did you become interested in neuroscience, neurophysiology, or movement disorders?
Well, before I went to the States and also during my residency in Minneapolis, I have come across with some patients with interesting, well, I shouldn't say interesting, but important movement disorders, particularly involuntary movements such as myoclonus. So I became interested in pathophysiology of myoclonosis. Therefore, I tried to apply my EEG techniques to the study of myoclonus and other involuntary movements as well.
I see. So that's a very good chemistry of EEG and involuntary movements.
That's right.
And the next question is, who were your role models or heroes in the field?
Perhaps I should raise Dr. Martin Halliday of the National Hospital Queen Square, London, UK. Because at that time I became interested in so-called Bereitschaft potential. I would like to call it just BP in this interview. And simply because the BP was just discovered by Dr. Kong-Fu van Deke in 1965 in Germany. And I thought that's a good start, to start with BP to study mechanism of voluntary movements non-invasively. So, but the reason why I found to work with Dr. Martin Halliday was we had three common interests, Martin and myself.